This is Mr. James Kirkpatrick, 58-year-old patient of Dr. Frank, who was admitted yesterday from the emergency department. When he came into the emergency room, he had been on vacation for a while and had not taken his medications for 3 or 4 days.
What is it he usually takes?
He usually takes Alupent, and he had been in respiratory distress for about 3 hours. Has no history of cardiac involvement. He's not allergic to any medication. His chest sounds had some scattered bronchi with crackles, and they had got a sputum culture from him because he had some greenish type secretions. His blood gases when he got to the emergency room when they took him was 7.28 pH, PCO2 of 50, PO2 of 58, bicarb 28, 90% saturation, and that was on a 100% non-rebreather mask. We intubated him and put him on a tidal volume of 800, an IMV of 10, FiO2 of 40%, and 5 of PEEP.
Is he breathing at all on his own with that?
He's breathing just a little bit. His respiratory rate's about 10, 12. His blood gases after we intubate him were much better. A pH of 7.42, a PCO2 of 41, a PO2 of 94, bicarb of 28, and an O2 saturation of 99%.
And what's his own tidal volume?
His tidal volume's 600. He got Valium 5 milligrams before we intubated him. He hasn't had anything since then. His vitals are stable. Heart rate is in the 80s, sinus rhythm, blood pressure is 150/90, and respiratory rate is, like I said, 10 to 12. And he's much more relaxed and much quieter.
What do you have running his IV?
In his IV, we got lactated ringers at 100 cc's an hour.
Okay, and we just have the right forearm.
Yeah, he's got the right forearm. He's nice and pink. He's looking real good, smiling at us.
Hi.
Yeah.
I'm your day nurse. My name's Nanette.